Hello, Dr. Manjunath.
Hello.
We celebrated Doctor's Day few days back. We are seeing a lot of young people developing heart diseases, and also many of them have succumbed to the heart disease. So there's lot of anxiety among public regarding the heart diseases and its sequelae. What are your insights about it?
Heart diseases are increasing day by day in our country as well as in our state. Previously, it was about 10% of people, of young people dying of heart diseases. But now we are finding almost 32% of patients are below age of 40 years to have a heart event. This is not a good sign. Previously, conventional risk factors are known to all of us, like diabetes, hypertension, smoking, obesity, and abnormal cholesterol. However, nowadays we are finding different risk factors. Especially among the young people, we are finding increased incidence of heavy smoking and vaping, having junk food, then excess alcohol intake. All this thing will affect the heart in a different way. At the same time, we are also finding air pollution as one of the main risk factors. Particularly if a air quality index AQI is less than 50, it is good for us. Like in Mangalore, it is around 24-25. But if the air quality increases above 100-150, it is unhealthy. Now, we are finding a lot of young people are stressed, too much of stress. Stress increases the inflammatory reaction in the body. The stress may be because of the workplace, or in the family, or in the business. And because of the stress, the cortisol levels in the body will increase, which can also lead to cardiac events. The stress also being added by involving in longer time of addiction to the gadgets, including the social media. Many of them are on mobile for a long time, and also into the social media like Facebook and Instagrams, which are negative, which will have a negative impact on the body. Especially it will affect the sleep, because we should have a good sleep. Is lack of sleep deprivation is also one of the risk factors for the heart diseases. I usually suggest that 1 hour before we sleep, the gadget should be off, so that we have a proper good sleep, which is beneficial to the body, because that is the time when the body recovers. In addition to this, especially in females, when they use hormone replacement therapies or oral contraceptive pills, this may also add to the risk of heart diseases. With this, we also find sitting disease as one of the main risk factors. So therefore, we should be always moving around rather than sitting for a long time. Above all these things, there is another most important risk factor is the strong family history of heart disease. If anybody in their family have the heart diseases documented in young age, like below 40 years of age, they should get properly investigated for it.
Okay, doctor. I just heard that if you are angry or if you are agitated for 2 minutes, your cortisol level is high for almost 7 hours. Is it true, doctor?
Yes, it is scientifically proved.
Okay. And also about the smoking, when you said, in spite of our government doing so much in the form of advertisements and giving a warning sign on all this tobacco products, when you said that smoking is increasing in younger adults, they are just irresponsible, I feel. So,
Yes.
doctor, are there any solution?
Yes, the solution lies with us only. We have to have something called lifestyle modification which has to be done. Like for example, we have to have healthy food. Everything should be in moderation. So we have to have a moderation in food intake, moderation in exercise, because excessive doing exercise is also detrimental to the body and is one of the risk factors for heart also. Moderation in even gadget using like mobile and other things, we should have our own de-addiction should be done in gadget using also. And many things is the self-diagnosis. We have to avoid self-diagnosis. Don't become a Google doctor. And avoiding self medication is another thing, because most of the people think it is gastritis and take some medicines, which may be a cardiac symptom also. Getting a good sleep is most important, and we should reduce our stress in life by using some stress busters like yoga, meditation, which is helpful in long term. So everything in moderation is the only way of changing the lifestyle.
Thank you, doctor. I also feel that exercise, yoga, meditation is an adjunct to your health, but getting a physical doctor's advice and investing in health is more important for prevention of cardiac diseases.